talking about burnout. We've heard of the term burnout, especially, when it comes to work-life balance, but parents are also really feeling run down and burnout as they're trying to care for their families and everything else they have going on.
Yeah, in fact, doctors are now concerned really about the impact of parental stress on health as a public. For more, we welcome Dr. Adam Bortland from the Cleveland Clinic. Welcome back.
Good morning.
Good to see you. So we're all stressed out. I mean, we know this, right? Parents have been stressed out for centuries. So what's now changed that we need to really maybe focus more on it?
Thankfully, this is a topic that's getting the attention that it needs and is frankly overdue. Burnout is very real, and I think parents are recognizing the physical and emotional fatigue that everyone is experiencing. The past 5 years, it's hard to believe it's been almost 5 years since COVID, parents are seeing just a real change in terms of the daily stress that we're dealing with.
Why has even COVID then had a different impact on our families? Or stress management, mental health?
Yeah, I think it comes down to balance. I think parents, recognize the idea of how do I navigate being a parent and all the responsibilities associated with that, and then also attending to professional dynamics, and trying to find that balance is really challenging.
And probably the working from home aspect was there, and having the kids at home during that time period. I think it really, for a lot of people, it kind of put them in a completely different mindset. You were, before COVID, it was like, oh, you just go to work, you do your thing, take care of your kids. But then people really questioned their whole life once that happened. And what do you do when you're taking care of your kids and trying to handle all that? So what are some things that you can do, that are different from what we've been doing before to really help break down that mental stress?
I think it really comes down to acceptance. The recognition that this is not a weakness to say, I need help. My gas tank is empty. So seeking that acceptance, seeking and receiving help, prioritizing self-care, which we often say, but we're maybe not so good at doing so. So I think if you carve out daily time to practice that self-care, it's really important.
But how do you then say to your kids, hi, I need to go do this for me. It's my me time, right? I mean, it's got to be a tough thing to just.
Sorry, I don't have dinner on the table, folks, but I need some.
But obviously you need it, but that's tough to do as a parent.
It is, and I think it comes down to communication, and I think kids actually benefit from recognizing that, mom and dad are human, and they need to take care of themselves, and there's nothing wrong with that. And, you come up with a schedule and you figure something out. Each family is going to be different.
You're actually setting a good example for your kids, saying, I need a little bit of time so I can be a better parent for you. Also, the dynamics of families has changed, and we've always had this where parents might be taking care of their kids. They're also taking care of parents. Also, sometimes now parents are aunts and uncles and grandparents. So now you have maybe someone in their 60s, 70s, 80s taking care of children. There's a lot of different dynamics and pressures and stresses of all of that too. And then add to all this the financial stress of so many people. It can really break you down.
Very much so. And that's where I think people are recognizing my plate is really full. I have a lot of different responsibilities, and I have to take care of myself. And that's okay. That's okay. And learning to say no is okay as well.
When do you know that you might need more help? Not just taking me time, but doing some things that you like to do to kind of relieve your mind and your stress. When do you know you might need therapy, or to talk to someone like you, an expert that might help you a little bit better?
Yeah, I think it's important to really take a look in the mirror and say, you know what, like I said before, my tank is on empty. And I can continue to push through, but at the detriment to myself, to my family. Maybe others are recognizing you seem kind of different. Not yourself, and that's okay. And like I said before, this is a strength. It takes courage to ask for help. Most of us can say, I'm going to push it to the side and pretend as though it's not happening. It takes courage to ask for help.
We got just a few seconds. Now that we've recognized this as a public health issue, what do we do as a society to make those moves to help it out?
I think we recognize that it's okay. We take the stigma away from it, which thankfully I think is happening more than ever. People are seeking mental health treatment and recognizing, in order to be the best version of myself, I'm going to dedicate the time to work on myself. So I have real optimism moving forward.
And hopefully it seems like workplaces are becoming a little more understanding with people calling off time and then even being allotted more time for those days when you're saying, I got a lot on my plate and I need another day or whatever.
Very much so. The flexibility within the workforce, I think, is finally becoming something more acceptable.
Dr. Borland, thank you so much. Appreciate the advice and the expansion of what we're talking about here, getting it out into the public, breaking that stigma, as you said.
My pleasure.
Thank you. Good to see you.